All right, great. Well, thank you everyone for joining us. This is the NRG Oncology Social Media Workshop. This workshop is put on by the NRG Communications Committee. Myself and Dr. Miriam Knoll are the co-chairs for this workshop today. I'm a thoracic radiation oncologist and professor and chief clinical officer at City of Hope Atlanta. So again, we really thank you for joining us. Dr. Knoll, I'll let you introduce yourself.
Hi, everyone. Good morning. So excited to be here. I'm a radiation oncologist at Northwell, working with Dr. Higgins for a couple of years running this workshop together. So we're really excited.
Yeah, so thank you guys for joining a couple days early before we start the NRG Oncology meeting. This workshop, we've held it virtually over the last few years. We feel like it helps engage the most number of people so you can attend, even if you're not attending the meeting in person. This workshop is recorded and it will be placed on the NRG Oncology website in about a week or so. So it will be viewable for others. If you think somebody else might be interested, please refer them to the website. And the purpose of this workshop is to share ideas around the way that we communicate in oncology. Of course, it's entitled the Social Media Workshop, but sometimes we talk about other topics that may not be directly social media related, but again, still related to that overall topic of how we engage. And I'm excited for our first topic today. It will be focused on the launch of our NRG Oncology podcast. And this is going to be brought to you by Dr. Stephen Chung and Dr. Lauren Henke. They together have launched this project. It came out of the Protocol Operations Management Committee, of which Dr. Chung and Dr. Henke are both members of. Dr. Chung is an associate professor specializing in lung cancer at MD Anderson. Dr. Henke is also an associate professor specializing in GI malignancies at Case Western. They're both thought leaders in their respective specialties, and really excited for them to talk to us about the NRG Oncology podcast. So with that, Dr. Chung and Henke, why don't you guys take it away?
Thanks, Kristen, for that introduction. Stephen and I are members of the Protocol Operations Management Committee, and I feel like the story for the NRG podcast really starts there. It's a committee that maybe gets sometimes less attention to those outside of NRG's POM committee itself, but it's focused really on one of the major goals of NRG Oncology, which is, of course, to support clinical trials and successful accrual of patients to these trials. And so we're always looking for new and novel ways to support that mission of NRG. And it was really from that the podcast was born. So we'll go ahead and get started. Stephen, do you want to lead the way here? These are our disclosures. When we thought about ways to communicate in our NRG and with that POM mission, one of the first things to always consider as you're trying to improve access or overcome barriers is to really examine what those barriers are. And in looking at clinical trial enrollment across the United States and elsewhere, some of the major themes and barriers to clinical trial enrollment are things that you would maybe ordinarily consider, things like transportation and travel difficulty or complexity of clinical trial design. Those are maybe things that we tend to focus on. But it turns out that one of the major barriers is really just language discordance and having understanding between principal investigators and those accruing patients to studies and their understanding of what that study is and how we communicate those goals and aims. And a facilitator, of course, is trust in a provider. And that is really built in many ways through communication. That's how we build trust with patients. And so how do we reach them? Traditionally, clinical trials use complex communication, really. Lots of lengthy protocol documents, lots of lengthy consent forms. The typical consent forms look a lot like your legal jargon maybe was you're filling out your taxes, things that we don't necessarily spend a lot of time going through, and patients, it turns out, also struggle to pull through these long documents. The average reading level in the United States is a 7th grade level. And when we look at actual literacy scores, where level 1 or below is literacy at the level of a 5 to 7-year-old, 1/5 of the population in this country is functionally illiterate. And literacy is really only getting worse after COVID-19 and perhaps in this really digital era that we're in. And so it makes sense as a segue that reading in America is in decline. Fewer Americans read for personal interest in a typical day. And in 2017, and it's likely worse now, less than 1 out of 5 men read daily out of personal interest. And reading for pleasure is, of course, also down. And so how do we reach these patients? Well, really, the answer is to modernize. And Stephen and I really like this quote, that the problem with communication is the illusion that it has been accomplished. And I think as clinicians, we really ought to take that to heart. We think that we're communicating things to patients through these documents and complex communication means, and the reality is that we're not. And one of the more modern ways to approach communication, for those of us who are, young and hip, or maybe like to think that we are still, is actually through podcast use. And that is something that's been really emerging as an approach in the academic community for medicine. You can see here some of the podcasts that are prevalent in academic medicine today. There are things like the Gynecologic Oncology podcast, the New England Journal of Medicine interviews, JAMA News, even ratings of the 43 best medical podcasts to listen to now. And so this is a tool that is becoming utilized in our field. And in fact, podcast consumption nationally is rising exponentially. You can see that the share of responders who use podcasts and consume podcasts was nearly 50% of the population as of a couple of years ago. And roughly half of Americans have listened to a podcast in the past year. One of the things that's really interesting, if you dive into this pie chart here, is that not only do people listen to podcasts frequently, it actually is something that older adults also listen to. If Stephen, you want to go to the next one. If you look at this chart on the right here, podcasts not only influence behavior, but they influence behavior of the demographic of people who frequently, unfortunately, face a cancer diagnosis and might be part of our target audience, if you will, when we think about the goals of NRG oncology on a patient level, that people in the 50 to 64 and 65 plus age bracket are listening to podcasts to learn, and they have their behavior influenced as a result. And 2/3 of adults ages 18 to 29 have listened to a podcast in the last year. So certainly this is a good way also to reach a younger audience. And so our goals, and I'll let Stephen take it here on the next slide, our goals are really to communicate about NRG oncology through plain language, through conversational approaches that are comfortable and accessible for our patients, but also for those that we work with, our colleagues who are part of this NRG mission and also benefit from having more accessible communication lines to understand and support and appreciate the goals and efforts of NRG oncology. We also have a goal, of course, to be the first and best podcast among the NCI cooperative groups, and to promote collaboration. It's also hopefully a forum for some timely communication about NRG trials, another means to communicate out studies that are ongoing or studies that perhaps have had protocol amendments or things that influence our ability to accrue patients to studies. And we hopefully will appeal to a broad target audience, patients, investigators, trainees, anybody hoping to get involved with NRG oncology. And as a result, we'll have diverse participants early stage investigators highlighted, and then also PIs of major studies and people in major leadership roles at NRG Oncology who can help to shed light on the overall goals of the organization. And to throw it out there, it's also potentially a funding opportunity. There's actually a lot of social media NIH funding opportunities. So Stephen, why don't you take it from here?
And so thank you, Lauren. And I wanted to, first thank the NRG Oncology Communications Committee and the Protocol Operations Management Committee for allowing us to embark on this project. And, it's just amazing that, having come up with this just perhaps over about 8 or 9 months ago, that we've been able to move it forward through the stakeholders present at NRG Oncology. In terms of the logistics, presently, we have an established shared vision between the Protocol Operations Management and NRG Communications Committees. They've been gracious to offer us resources for this project. That's including the recording technology. But some of the resources are really freebies. Social media, there's Twitter, there's LinkedIn, Facebook, whatnot. There's no cost to NRG with regards to any of those resources. And NRG stakeholders, whether they be patients or trial coordinators or principal investigators, being willing to talk, again, that's a resource that's really a freebie. We've also considered risk mitigation here. We don't regard this as being without risk, although we believe that the risk of something like this is minimal to NRG. But just as a matter of principle, we are completely avoiding any talk about politically charged topics. We also have had the help of Angela Peer, who is helping to edit the podcast judiciously. We also vet the topics with the Protocol Operations Management Committee. And for podcasts that are going through clinical trials that are currently open, we have these podcasts reviewed by the Institutional Review Board to make sure that we are not overstepping our boundaries in terms of advertising inappropriately to patients potentially. That being said, we do not have the IRB review podcasts on protocols that have recently been completed and reported, for example, at the recent ASCO meeting. There's no patient recruitment involved at that point. So, recent results of important NRG protocols, which is also a component of these podcasts, that's not reviewed. And so the episode lengths, we wanted it to be accessible. So roughly 20 to 30 minutes. Our plan is, at least initially, to release the podcast monthly. And as we understand the workflows better, we we get into the rhythm of things. Our hope is to perhaps even increase this to bi-weekly releases, coordinated with the bi-weekly emails, for example. Lastly, I wanted to mention, risk mitigation. There is risk here. I think many of us are familiar of when Howard Bachner had to step down as the editor-in-chief of JAMA because of an inflammatory podcast. Believe me, we are not going to get into highly sensitive topics. That's just not what this podcast is about. We have already recorded a number of podcast episodes that are on the list for release. The first one that'll be released at the NRG Oncology meeting is Dr. Quinn Lay, who's the NRG Cooperative Group Chair. She's going to talk about NRG Oncology broadly and the history of RTOG. We also had Dr. Stephen Lai, who talked about HN006. We had Dr. Robert Mannel talking about the GOG, Dr. Puneeth Iyengar, who spoke about NRG LU002, just presented at ASCO, and so we hope that this helps broaden the message of his trial just presented and broaden NRG's message. We're going to be interviewing Dr. Anuja Jingran today about RTOG 0724. also presented at ASCO. The scheduled podcasts that we have include Dr. Karen Goodman at NRG later this week. Dr. Werner Wasik, Henke, and myself are going to give an update on protocols that we're hopeful we can generate more enthusiasm for out of the Protocol Operations Management Committee. And then later this month, we're going to have Dr. Jennifer Wenzel and Dr. Evan Graboyes talk about the Health Disparities Committee, which I think we can all agree is an important integral mission and part of NRG Oncology. We have a number of podcasts in development and scheduling. We've been trying to get Dr. Woolmark on the books, and I think in the very near future we'll get this nailed down to talk about NSABP and surgery. Another protocol out of the breast group, the HERO trial. We are interested in having Dr. Melissa Mitchell and Dr. Leah Brownstein. There's also the brain metastasis trial for small cell lung cancer by Vinay Gandhi, the Forte trial with Dr. Robert Schoen. Dr. Benjamin Movsa has reached out to me wanting to speak about patient-reported quality of life. And we also would like to get a podcast scheduled on patient advocacy and new investigators. And we really have not turned anyone down so far who's expressed interest, perhaps with one exception. Someone reached out to me wanting to do a podcast on an ECOG trial. And I kind of had to turn them down. I said, this really, this is an NRG oncology podcast. This has got to be something related to NRG oncology. And so, we really want all aspects of the organization to feel welcome and to participate. And I other than it being something, just unrelated to NRG oncology, I don't really have what we would call in a protocol exclusion criteria. In any case, we also were able to secure theme music for this podcast. I mentioned in the RTOG Foundation interview that while we don't have the budget to pay for something by Avril Lavigne or Taylor Swift, and when you look at music, the royalties on music actually goes back further than you would think. Even for something like Rhapsody in Blue, composed 100 years ago at this point, that did not go off of royalties until about a year and a half ago. So even orchestras, when they wanted to perform Rhapsody in Blue, they could not just purchase it. They actually had to rent it, and it was very expensive. So I had to reach back a little further because I we don't have the budget for something more fancy, but I called up my friend, and perhaps some of you know him, Jackie Parker. He's a world-renowned cellist. He plays in a quartet at Rice University along with Desmond Hobig, virtuoso cellist, former principal cellist of the Cleveland Orchestra and the Houston Orchestra, and Kathy Winkler. You can see YouTube videos of her from when she was trained by Jascha Heifetz as a young girl. And they provided me with the Smetana Trio, which Angela Peer brilliantly put together with our podcast as a theme music. And so, in conclusion, I really want to thank certain people. I mean, there's so many people to thank. I can't thank everybody in the time constraints here, but Angela Peer has just done an outstanding job editing, showing me how to record, working with splicing the music, doing stuff behind the scenes with IRB, etc. Dr. Maria Werner-Wasik, who immediately encouraged us to do this and supported us. And I was actually thinking that this was going to take a year to get through, and she said, "No, why should we do that? Let's just do this now." And so I'm very grateful to her for having pushed us along, and Kristen Higgins for being the liaison between the Protocol Operations Committee and the Communications Committee, and along the way, just being an advocate and encouraging us to get this live. And so it'll launch July 26th at 8 in the morning Mountain Time. I hope some of you can find some time to listen to our first podcast with Dr. Lay. Um, Lastly, I wanted to, since this is a social media workshop, provide you with our Twitter handles. Lauren and I are both on LinkedIn. I'm not on Facebook, but I actually had not been a Twitter member until about 2 weeks ago, and finally, Dr. Henke, my own section chief, Shalin Shaw, um, many people, Simon Lowe, I mean, just any number of people who have been telling me for years, you should get on Twitter or X, and I finally. I finally caved to peer pressure. So that's my Twitter handle. I'm probably not the most adept person with Twitter yet. So any help I can get from the social media experts who are part of this call. I've already gotten some help from Dr. Mimi Knoll, who I met last week at the ASCO Leadership Development program. But I want to open things up for questions and comments. Feel free to email either of us, and we just want to see trials successful and NRG have more influence widely amongst our patients who need better cures and treatments desperately.
Thank you so much, Dr. Henke, Dr. Chan, for an amazing presentation. I know I'm really excited to listen to the podcast. We're going to save the questions for the end. So just a reminder, everyone can please, if you have questions and don't want to forget them, to put them in the chat box now. But before we field questions from the first presentation, we are going to move to Dr. Commander. Who is someone that I have followed on social media for some time. So I'm really excited to have her here today. Dr. Commander is Director of Breast Oncology and Cancer Survivorship at the Mass General Cancer Center in Waltham and Newton Wellesley Hospital, and the Director of Lifestyle Medicine, which is a pioneering program in the field of cancer care. She's dedicated to enhancing the quality of life, well-being, and outcome of patients with cancer, and is really active on social media to bring attention to these efforts. So we're really excited to have you speak, Dr. Commander.
Thank you so much for that introduction. Just going to bring up my slides. I also just want to thank NRG Oncology and, of course, Dr. Higgins and Dr. Knoll for inviting me to join you today for this great workshop. I also loved hearing from Drs. Chan and Henke about the podcast. I think that sounds amazing. And I think even though this is a slightly different topic, I think we have similar goals. How can we utilize tools to best communicate with our patients to help them optimize their outcome, whether that's searching for the best clinical trial or treatment for their cancer, but also what steps can they take to improve their lifestyles? And since increasing data has really demonstrated the importance of these tools for our patients with cancer. I also thought it was really interesting that Dr. Henke shared that slide showing the utilization of podcasts and how 36% of individuals found that they would change their lifestyle based on listening to a podcast recommendation. So this is so important to emphasize that the recommendations that are getting out there to our patients are evidence-based and really not based on a lot of the other things we see on social media. So on that note, I'm going to get started and just highlight, I think for this group, I think we're all aware that thankfully, due to advances in cancer treatment, early detection, we are seeing an increase in the number of cancer survivors living in the United States. And in fact, by 2030, this number is predicted to reach 22 million, which is really exciting, but also an opportunity to think about how can we optimize the outcome of our patients from cancer as well as their health and well-being. And that's really where attention to evidence-based lifestyle interventions plays a key role. So in this brief talk, I thought we would talk a little bit about why health promotion is a key component of survivorship care, what is lifestyle medicine and what are the 6 pillars of lifestyle medicine. And then, of course, touch on the importance of advocacy and use of tools such as social media, podcasts, and other strategies to integrate evidence-based lifestyle medicine into care of cancer survivors. So I know this group is familiar with the critical elements of survivorship care, which are outlined on this slide. And really the one I want to focus on is the promotion of healthy behaviors. Certainly everything on this slide is absolutely key when we think about providing comprehensive care for our patients with cancer. But this final bullet point, how do we promote healthy behaviors, is a challenge for many of us in the oncology field, mostly because a lot of us were not trained with these tools, how to counsel our patients about diet, exercise, weight management, etc. And so why is this important? So this is a slide taken from the New England Journal, actually now I'm noticing over 20 years ago, but really highlighting back then that obese individuals are at increased risk for developing and dying from cancer. And this has been associated with cancer of at least 13 different anatomic sites as outlined here. Obesity is associated with increased overall and cancer specific mortality, especially for our patients with a history of breast, colon, and uterine cancer. So again, what are the mechanisms that explain this? And certainly ongoing research is trying to understand these mechanisms. Is it due to chronic inflammation in the body, insulin resistance, changes in our gut microbiome, changes in the tumor microenvironment? Certainly there are lots of hypotheses that are being tested, but this is really a wake up that weight management should be a key component of care for our patients with cancer. In addition, increasing data demonstrates that our patients who have been through lots of different types of cancer treatment, as outlined here, are unfortunately at heightened risk for cardiovascular disease. In fact, this is a slide taken based on the ERIC study, which showed that cancer survivors have a 37% greater risk of cardiovascular disease compared to those individuals without a history of prior cancer. And again, a wake up that we really do need to pay attention to our patients' cardiovascular risk factors and thinking about how to improve their outcomes so they don't later develop cardiovascular complications. And then finally, I know I'm sitting right now and not using my standing desk, but there's increasing data showing that increased sedentary behavior is also associated with poor outcome among cancer survivors. And specifically in this study, prolonged sitting and lack of physical activity, unfortunately, is quite prevalent amongst the cancer survivor population. And those individuals who have increased sedentary behavior, unfortunately, have increased all-cause cancer-related and non-cancer-related mortality risk. So again, the saying is sitting is the new smoking, but we really do need to counsel our patients on the importance of being active, and ourselves, by the way. So an important study that really looked at these issues was a survey published by ASCO, actually back in 2019, just to highlight that back in 2014, so 10 years ago, ASCO did make obesity and cancer a core initiative. And so the goal of this particular survey study was really to have an understanding about what are oncologists' knowledge about nutrition, physical activity, and weight management, and how are we doing in terms of addressing these issues with our patients. And perhaps some of you were part of this study. I do recall doing this survey myself. And I will acknowledge that as 88.8% of physicians agreed that a patient's weight should be, addressed as a standard part of cancer treatment. But unfortunately, only 1/3 felt that they had adequate training to do this, to address this issue with patients. And at least about 50% noted that really there was a lack of training, lack of experience in learning how to address weight issues and behavior change with patients in oncology clinic. And over 60% felt that there really weren't resources out there to help our patients address these goals. So this was really, again, published about 5 years ago, highlighting that we need new initiatives to support education and training of our oncology workforce in order to address these important lifestyle issues for our patients with cancer. And we need to understand our patient perspectives. What guidance do they want and need when it comes to addressing weight, physical activity, diet change, etc. So I think this was a really important study that highlighted the need for us to be more educated about these areas. In addition, there was a patient survey published back in 2022, also done by ASCO, to really look at, from the patient perspective, how did the patients feel that these issues were being addressed in their routine oncology visits? And if you look at this table here, about half of the patients did say that these issues were being raised in their clinic. Maybe their doctor asked, are you exercising? Tell me about your diet, etc. But if you look farther down, how many patients were actually maybe advised to lose weight, a very small percentage, how many were advised to exercise or referred to an exercise program, also maybe only 14%. So we really do have a lot of work to do in this area. An important point that was noted in this publication is that for those patients who did get a recommendation from their oncologist to exercise or focus on losing weight, that was actually associated with positive changes. So again, this behavior change piece is so key. In our very limited time with our patients, if we're able to talk to them briefly about these topics and encourage them to make these changes, that does make a positive impact. So I thought this study was pretty interesting. This was published just a few months ago in JAMA Oncology. And this was a survey study, actually a cross-sectional study using data from the CDC's behavioral risk factor surveillance system. So this is based on data from telephone calls where individuals are self-reporting how they're adhering to certain guidelines. So, and this was focused on individuals with a history of cancer and asking them some very basic questions about their lifestyle, about physical activity, their weight, alcohol use, and whether they're eating fruits and vegetables. And these were like very basic questions. Like the exercise question was like, have you exercised in the past 30 days? The alcohol question, do you drink alcohol? These are like very basic questions. But I will acknowledge what was highlighted in this study was really only 4% of cancer survivors in the United States were adhering to all 4 of these pretty basic guidelines. So I think this is just another wake up that we have a lot of work to do in this area. So that's where lifestyle medicine comes in. And some of you may have heard of it, maybe you haven't, but it's really a field that I've gotten interested in really as a way to help educate myself and my colleagues, and of course my patients, in order to improve their health when it comes to these important lifestyle interventions, which are increasingly relevant for our patients during survivorship. So the field may be designed as a therapeutic use of evidence-based lifestyle interventions to help treat and prevent lifestyle-related diseases. And the piece that I also find really interesting is the focus on behavioral change. How can we empower our patient with the knowledge and skills to make these changes as outlined here? And on this slide, this really highlights what we call the 6 pillars of lifestyle medicine, which we could go into in great detail, but just for the purpose of this talk, really a focus on nutrition with a focus on a whole food plant predominant diet. What are the recommendations when it comes to physical activity for cancer survivors? The important role of stress management, which we know is absolutely key for our patients. Sleep, increasing data is really demonstrating the importance of adequate sleep for cancer survivors, and social connection, as well as avoidance of risky substances such as tobacco, alcohol, etc. And I will say that in terms of our ASCO guidelines, exercise is now a key component of ASCO guidelines. And this was released about 2 years ago that, oncology providers should be recommending aerobic and resistance exercise during active treatment with curative intent to obviously mitigate side effects of cancer treatment, but also there are so many other benefits which are listed on this slide taken from the ASCO guidelines, helping with cancer-related fatigue, cardiorespiratory fitness, physical functioning and strength, improving quality of life, reducing anxiety and depression, and tolerating treatment better. And certainly as a breast oncologist, there's so much data now demonstrating the absolute importance of exercise in addition to helping reduce risk of cancer recurrence and improve outcome for my patient population. So this is so important, and I will acknowledge, and certainly we can't take a poll right now, I wish I could, but I really would be interested in how many on this call do counsel their patients about exercise. I will also note that our patients with advanced cancer obviously benefit from exercise as well. I just saw a patient right before this who has been on abemaciclib and anastrozole for over 2 years for her advanced breast cancer, and she gets outside and walks for 30 minutes each day because she knows she feels better, she feels she can tolerate her treatment better. Again, this is such an interesting area in terms of further research to help understand the mechanisms by which exercise benefits our patients. So just speaking a little bit about what we do at Mass General, we developed a lifestyle medicine program. I will acknowledge my wonderful colleague, Dr. Betsy O'Donnell, started this program a few years ago. She's a multiple myeloma expert. And really the goal was to help counsel patients in an individualized setting, and now we do group visits as well on the important role of lifestyle medicine as a key component of oncology care. And we have many offerings now, which are listed here, one-on-one consults. We now have shared medical visits for patients to work in a group on these lifestyle changes. The program I'm excited to talk a little bit about is Paving the Path to Wellness, which is a lifestyle medicine-based survivorship program specifically for breast cancer survivors. And then, of course, a key component of this is providing education about the important role of evidence-based lifestyle interventions, certainly for our colleagues, but also for our patients. And that's where social media patient advocacy comes into play. And so this is just a quick overview of the paving program. Again, and given our limited time, I just want to highlight that the goal of this is a 12-week program that we now offer via telemedicine since the pandemic, in order to really provide education to our breast cancer patient population about the importance of lifestyle medicine tools to optimize their health after completion of treatment. And it's in a group setting. And I will acknowledge, as you may recall on that slide about lifestyle medicine, social connection is one of the 6 pillars. And when I first launched these groups a few years ago, I kind of underestimated how much that piece was so key. But I will say the social support that the individuals provide to others in the group is absolutely amazing, and maybe the most important part of the program. And we're thinking about helping people make behavioral changes. So over the past few years, we've really, paving as a movement. Okay, the ladies came up with this term, but we've really learned that the support piece, the community, is really key for helping individuals, whether it's starting an exercise regimen or incorporating more fruits and vegetables into the diet or cutting back more on alcohol. Just in terms of making these lifestyle changes, that support piece has been absolutely key. And of course, we've been using lots of different, strategies to help promote this. We have a newsletter. The patients promote a lot of this important information. And of course, we've been developing our own social media accounts to help promote these activities and build community. And this is just an example highlighting the social connection. Again, given the time, I'm not going to read this slide, but really just highlighting that this was like a yoga class we did actually back in April, really that these women feel so bonded to each other and find that, obviously that sense of support and understanding from other individuals who've been through breast cancer treatment. But also they just love doing things together, being active together. And it's really been so remarkable to see this. I will say I've also been fortunate the past few summers to collaborate with my colleague, Dr. Naomi Ko, as well as my colleague, Dr. Erica Warner, to offer this program at Boston Medical Center, which really serves a more underserved patient population where, unfortunately, they don't have a lot of survivorship programming there. And so, as you can see, these women had an amazing time during the paving program. We did it in person there. And again, really important to advocate for these tools for our patients who are in underserved communities as well. So highlighting, again, in terms of getting back to this theme of communication with our patients, providing education, but also the tools to be successful in making these behavior changes. Again, these are just some key bullet points from the recent ASCO education book published, like just focusing really on this concept. How can we help our patients adopt healthy behaviors? And again, I agree with all the bullet points that were outlined in this article, helping our patients find things that bring joy, helping them learn strategies for goal setting, monitoring behavior. And again, I would say social support and accountability is probably the most important thing. In terms of further strategies we're using to try to get disseminate this information, here at Mass General, we developed this webinar series that we kind of make open to everyone, and we've done our best to promote this, whether it's on Twitter or LinkedIn or Instagram. And so we've been recording each of these webinars, really focused on tools from lifestyle medicine, focused on oncology. And actually, we've been making an effort to get them on YouTube. I know Dr. Henke shared some data from the Pew Research Organization earlier about social media. And it's interesting to note that, interestingly, I don't see podcasts on this particular graph, but use of YouTube is definitely on the rise, as well as Facebook and Instagram. So we've been trying to get our webinars out onto YouTube, and some of them get nutrition. There's so much interest in nutrition. One of our webinars has over 36,000 views, which is kind of crazy. So just highlighting that people are out there really looking for this information. So it's so important to provide the evidence-based information to individuals who are looking for that. And these are just some examples of some of our webinars that we just did in the past few months, including an exercise class, which was, again, this was a project led by my colleague, Dr. Betsy O'Donnell, where they filmed a few exercise videos for patients, which is a really cool thing. Again, my colleague, Dr. Erica Warner, has really taken on how can we improve survivorship care among Black women with breast cancer. And so she's made some videos in collaboration with another team with these fun animations, really highlighting the tools of lifestyle medicine in these videos. And these are available on YouTube as well. So again, I just am grateful for the opportunity to discuss this important topic. Again, so important to promote this information about lifestyle medicine to improve our patients' access to these tools. And I think the supportive community, whether it's virtual or in person, is so great to help our patients adopt these behaviors and, improve their health and well-being. And so these are just some wonderful members of our team. I'm sure I'm leaving some people off here, but I'm so grateful to work with this wonderful team who shares this mission at MGH. And my contact info is there if you have any further questions or would like to reach out. So thank you so much.
Thank you, Dr. Commander. That was so interesting. I find the lifestyle medicine to be very intriguing and understudied, and really kudos to you for bringing it to the forefront and for focusing on something that hasn't been studied very much in oncology. And I think that is such a unique niche. I think it's super interesting, and it would be interesting to find a way to test the use of the lifestyle medicine toolbox in cancer survivorship. I mean, there's so many different things that you could do with that. And you're really one of the pioneers around the topic. So we're very fortunate to have you on our workshop today. And so right now we'll open it up to questions to any of the speakers. Please feel free to use the Q&A function on Zoom to send your questions in, and then we will share the questions. We have about 20 minutes remaining to just talk openly about what topics were discussed today, any questions that people have. I guess I have one question for Dr. Commander about the lifestyle medicine. Are there any patient populations that are particularly more open to hearing about lifestyle medicine that you found in your practice? I know you're a breast cancer oncologist, so that might sort of influence the patients that you see, but just looking at lifestyle medicine holistically, where is it really sort of catching on in oncology care?
Great question, and thank you so much for your interest. And yeah, so I am biased as a breast oncologist. Of course, that's the population I work with, and the paving program I really adapted for that patient population. But I will say in our clinic here at MGH, where we see patients with any cancer diagnosis, we do see interest from a wide range of patient populations. Young adults with cancer, I think that's an area where there's a great need, and we're trying to focus more on an effort to help provide more education there. Individuals with prostate cancer, there seems to be, men are really interested in this too, right? And so again, I don't treat men, but the men who come to our clinic are very motivated and interested. Certainly in some of our patients with a history of sarcoma, hematologic malignancies. I feel like there's so many untapped areas where that research and these interventions have not been utilized as much. The GI cancer patient population, especially these young adults now with GI malignancies, which sadly is on the rise, potentially due to lifestyle factors. We're still obviously sorting out the factors that contribute to that, but I do think all patients will benefit, of course. But so I think it's a growing area that certainly needs more attention, not just in the breast cancer field.
So I have a question for Dr. Henke and Dr. Chan about the podcast, which I'm so excited to listen to. Is your audience more other clinicians and clinical trial professionals, or patients, or both? And how is a recruitment strategy in terms of listenership and audience sort of tailored for those efforts?
We're really hoping to be able to reach a relatively broad audience. I think as we launch launch and see who is engaging most with the content we're putting out. That will probably shape some of our content as well. But really from the get-go, we're hoping that there is something to be found in this podcast for patients, for patient advocates, for clinicians, for early career investigators who are hoping to understand the apparatus that is NRG Oncology. You know, it's a complex organization, and just learning from hearing these conversations about how you navigate the organization and how trials make their way to be, I think actually is incredibly beneficial across the board in understanding how these trials come to be, the questions that are being asked, and who can really engage with that content as truly anybody. We'll certainly have some certain themes like highlighting big ongoing trials, potentially tackling some of the trials that, as we joke on the protocol operations committee, are on the naughty list in terms of having some accrual challenges. Some studies by design are just tougher to get people to consider enrolling patients on, or have technologies that may be harder to access. And so we're hoping to use the podcast as a way to break down really all of these different styles of barriers. As far as how we're hoping to advertise it out, you know, we're getting it indexed in a variety of podcast sites. It sounds like we apparently need to get these up on YouTube from the sounds of it. Maybe some Facebook streams. So we're going to broaden out Stephen's social media literacy far beyond just Twitter X account creation, and really become gurus, hopefully. And certainly lots to learn in the process from people like yourselves who have been able to leverage social media so successfully, really to the benefit of our patients and our colleagues. So lots to learn and lots to tackle, and it's really an exciting time, I think, for us.
Yeah, and if I might add something brief, while we are looking to reach patients, really every component of the organization, caretakers, clinicians, etc. I think perhaps that this is geared I don't want to say to clinicians, because really, we're aiming to gear this to people who are on the front lines, whether this be, the coordinators, enrolling physicians, or just, other, people who are on this, who want to understand better what this protocol is about, or what this element of NRG is about, without having to go dig through a document, without having um, to go find the document to dig through. I mean, that's a that's a problem in of itself, right? And I'm willing to bet that rather than when someone, is perhaps wanting to learn a little, okay, do I want to open this trial at this institution? Or, what is the role of this committee in the broader structure? They'd rather put on a 30-minute podcast than try to go through some organizational chart or some protocol language or consent or something like that. So really, I think if I were to put who this is geared towards, and while certainly patients are welcome to listen, I think this is for people on the front lines, that would certainly be, clinicians, because I think in some degree, when we recruit patients to trials, yes, some patients may actively be looking for that trial, but a lot of this is the clinician being educated in really layman's terms, how can this be presented to a patient? Most of the patients I enroll on trials don't come to me with prior knowledge about it. They come to me, okay, which trial is appropriate for me, and I speak about it. And so yeah, I think perhaps if I could ascribe the focus to anyone, it's just, people on the ground who are enrolling patients on trials, and that's not just the physicians.
Even just a quick question about the focus audience of the podcast. I hear your point about, frontlines physicians who are trying to get patients on studies. Will you have any content that's more focused towards, let's say, advocates,
Oh,
people who
absolutely.
are helping
Yeah,
patients through their journey of cancer
yeah.
diagnosis?
Oh, absolutely. We've had advocacy reach out to it. That's one of the pending concepts that's in development for this year. And we certainly want to have advocacy on and that'd be part of the plan in the first 12 months. Absolutely.
And then with that, any thoughts to doing any podcasts in languages other than English, just to sort of broaden the reach?
Oh, that's another great question. I haven't delved into that yet. I'd want to see, how the first podcasts go and the interest and how it's received. I think something like that is going to require resources and, you know, certainly additional effort. Um, I don't know if those resources are going to include, budgetary resources, although I did bring this up.
I think Stephen might have frozen, but it's a topic that we've discussed absolutely.
Okay, no, I just
Oh, there you're back now, Stephen.
sorry about that. I don't know what happened, but yeah, to your point, Kristen, I did recently speak with my aunt who is fluent in medical Spanish because she's a pharmacist. And, maybe we can make something like that work.
Yeah, I mean, I think that would be great. Something in Spanish would be, I think, would reach quite a few patients, investigators, family members, caregivers, things like that. So that would be great.
So another question for Dr. Commander. Can you share a little bit more about your own personal / professional social media use? I follow you on Instagram, see you running those marathons. How does that sort of play into your work as an oncologist running the lifestyle medicine program? Like, do you find that people sort of find you on Instagram, or is it, it's just simply a really important expression of who you are, sort of, doing what you say? So I'd love to hear more about that.
Oh, thanks for asking. Well, I will say that, I mean, that one of those studies I highlighted, which was that, patient survey study of their health behaviors in oncology, and those patients where their doctor talked to them about exercise, their diet, et cetera, actually were more motivated to make changes. So I've actually noticed that over time, if I share a little bit more about my own hobbies and passions, which are maybe a little bit too much running or Peloton or whatever it may be, my patients do love that, and they love to like talk about it. And it's actually really nice to hear someone say, wow, I signed up for a 5K because I saw you ran Boston and I thought that was cool and I want to start running too. So I think it's interesting, like our patients really do look to us for guidance, of course, about their cancer treatments, et cetera, but also when it comes to these lifestyle behaviors, I think it is important to practice what we preach. And so I think it does, studies outside of oncology, of course, have shown this too in primary care, internal medicine, et cetera. So I think that, and it is really wonderful to kind of see that, see these kinds of things help our patients live healthier lives as well.
Well, I think I had one other comment from Dr. Julian. Dr. Julian just wanted to comment to Doctors Henke and Chung that presenting the podcast concept to the disease site chairs during their meetings would be a great idea, just to generate more content and more ideas. So, although it sounds like right now you might have a backlog of ideas, because I think you're getting a lot of enthusiasm from people throughout the NRG organization.
It's not a bad problem to have, though. I mean, interest and engagement is what we want.
Definitely.
And I think, the disease state chairs have maybe some unique insights into what particular protocols might be challenging or may need added layers of communication to really get the messaging out that they know about far before a protocol maybe goes entirely live. And again, we start seeing it on the accrual naughty list or something along those lines. So absolutely. And we're really excited that with the launch of it this week, that we'll be able to, more publicly engage with everybody, not only within NRG, but also the broader audience.
If anybody watching this, this workshop has an idea for a podcast, should they just reach out to you directly?
Yeah, absolutely. We'll make sure that Stephen knows how the Twitter DMs work, and myself included. Please email, please reach out to us. If you see us at NRG, if you're attending, come find us. We're friendly people. We'd love to talk. We'd love to hear your ideas.
Yeah, and really, you have an idea. What we probably are going to ask is, general idea, and then, five, agenda or bullet points of an outline of what you want to talk about.
Oh, we have just 5 minutes left. So I would love to end with just quick answer from each of you. Dr. Chun mentioned how we just joined Twitter. But for each of you, if you were to tell other clinicians, oncology professionals, our audience here, and others who are interested in sort of getting involved in social media, what's your best advice to them? We'll start with Dr. Comender.
Get myself off mute. Well, I will say, just following up Dr. Knoll on your comment earlier that I show my runs and some of the crazy stuff I do. Being your authentic self. I think I've gotten feedback. Again, I didn't start sharing that stuff, to be honest, for my patients to find it, but some of them do. But I just think showing, like, I went out for a run today and it was raining, and what are the benefits of running in the rain, which, by the way, I love doing. And so I think, just being authentic, and I think people really, that resonates. So that would be my piece of advice. Should I pick on someone else to go next? Dr. Hankey?
Absolutely. I think for me, I'm social media adept. I'm young enough that is something that I've really grown up with, but also engaging with that on a professional level, I think can be really intimidating. Making sure, that you feel like you have your phrasing right. So I think for me, it's really just about not being afraid to use these tools. And of course, you want to come across as professional and get your ideas out there in the quote right way. But oftentimes the right way is to just get it out there and try, and you'll learn as you go, and not being afraid to leverage these tools because they can be really powerful.
So, it's interesting, I'm not on Facebook. I wasn't on Twitter until about 2 or 3 weeks ago. Actually, I was one of the first people to join Facebook in 2002 when it first was introduced by Zuckerberg. And I was actually a pretty active user up until, and I know exactly when it was, 2013, when I had to study for radiation oncology physics boards. And at that point, I was already kind of irritated with it. There was just, a lot of extraneous noise. Sorry, I think I froze up again. But there was extraneous noise, um, and it was just very distracting. And so I left Facebook, 2013, 2014. I never went back. But I've been a member of LinkedIn for a long time, thanks to the great Dr. Wafik El-Diri. He's the dean at Brown. He's formerly at UPenn. He discovered P53, P21, famous guy. And I've always liked LinkedIn. But when I joined Twitter or X a few weeks ago, I actually think in the 10 years since I've been off of Facebook, that's served me well in terms of how can I emotional maturity. I very intentionally have all notifications turned off. I don't feel the need to I'm 41 years old. There's some people who just want to immediately respond to stuff. I'm aware, want to troll people. I have no interest in responding or making comments like that. Um, I not that I'm a social media person, but if I can, suggest to, and perhaps this is in alignment with the whole country right now, let's all just keep it positive and be unified, right?
Yeah, using it on your own terms, I think is really important.
really like to thank all of the speakers. This was a fabulous workshop. We learned so much. And a great way to kick off the start of the NRG Oncology meeting.